Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we have our all-star business panel here to talk about, guess what? Roads and bridges and mass transit, plus liquor privatization, and then an important health care update, all that and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, we've been doing this continuing series on Governor Corbett's very aggressive agenda. We had representatives from the Pennsylvania State Education Association here from the union point of view. We're now going to hear from the business point of view with our panel, consisting of, as usual, Fred Anton. He's the CEO of the Pennsylvania Manufacturers Association, and Gene Barr. He's the president and CEO of the Pennsylvania Chamber of Business and Industry. Guys, welcome as always.
Great.
All right, Gene, I want to start with you on this business of transportation, and we get the liquor privatization. I'll Fred weigh in first. All right, look, every study, I think we have now 3, say we've got to do something about roads and bridges. We get different amounts of money out of different recommendations, but let's say we're up to $2.5 billion a year that we need.
Right.
And there's a debate about how to fund it.
Right.
So from your point of view, should we be doing a huge expenditure of money in order to fund roads and bridges? Weigh in, give me your viewpoint.
It's rare you'll hear me come on the show and talk about the fact that government needs more money for something. This is a case where it's different. We believe that what we're talking about here, transportation infrastructure, is a core function of government. We need to do this. We need significant more dollars into this system. However we get it, we're open to a wide variety of ways of doing that. And the reality is the ways that we're looking at are really user fees. You use the roads, you pay for the roads. You pay for the roads when you go to fuel up. You use the roads and you pay for the roads when you register your car, do your operator's license. We need, and I know no one likes to hear that, but if we don't put those dollars in, we're going to continue to have a system that fails, bridges that are closed or unsafe because we haven't been able to keep them up, mass transit systems that can't transport people to their jobs, to doctor's appointments, as well as ports and airports. It's a combined infrastructure that needs the attention.
Fred, your position on this?
We unqualifiedly agree with the governor's proposal and the governor's recommendation, and we believe it should be passed immediately. Now, having said that, if there's any question here, it's that there's not enough dollars being put into the roads and bridges quickly enough. As I understand the governor's proposal, there will only be available $500 million during the first year, working up over 4 years to $1.8 billion. That is far below the governor's task force that recommended, I think, $2.8 billion or something in that area annually.
Right. That's a good observation. Gene, of the raising the oil franchise tax, that's probably going to raise the most money. I get this, little more than $1 billion a year when it's fully implemented.
Right.
License and registration fees, you indicated you're open to that.
We are.
Are there any other possibilities out there? I mean, you talked about, would we do some additional tolling and private partnerships with, you know, maybe over bridges, or we don't seem to have a lot of toll. I'm not suggesting we ought to toll every road in the state, but you travel around the country, you can't go anywhere without having to
likes paying tolls either.
Quarter in some
But the reality is, if you're driving up I-95, you're paying them in Delaware, you get to Pennsylvania, you don't pay. I think with the electronic measures that we can do now, you can accelerate the collection of those. You don't have to slow down in many cases. People can go through the gantries. You don't have to worry much about that. We're open, as I said, to most anything that really ties this into the transportation side and really functions as a user pays. So we're open to any number of different things. You know, and of course, this is just it's a governor's proposal too. It's going to be kicked around.
Let's talk about the politics of this. It seems that if Republicans that control the legislature, we agree there. Not, you know, Senate's a little closer, obviously. House pretty substantial. Republicans could do this if they want, right, Fred?
They could do it,
Republicans could
but
do it.
This is likely to be regarded by some, and it is said by some, to be a tax. Also, 26 cents a gallon, which is what the uncapping will mean if fully implemented. 26 cents a gallon passed on to the consuming public is a heavy lift for some people. This proposal I regard as a very, very significant first step, and it should be passed.
Mm-hmm. Let me ask you the fundamental, look, both you guys pay a lot of attention, legislature. As usual, I'm going to put you on the spot. You know, you wouldn't come on here not expecting both of you. Is the legislature going to do this? This is a big priority. I think everybody admits this. Number one, Fred and I were talking before. He thinks, I'll let him explain, it's the number one priority that should be done.
I think something will happen. What that ultimate number is, I don't know. And yes, this is, from our perspective, raising the oil company franchise is an additional cost of doing business on those companies that will attempt to get those dollars back. The reality is we need the dollars, and I believe that something will be done. Whether it completely goes to the level people want is another question, but I believe something will be done.
We got to run to a break. When we come back, we're going to take up another controversial subject, the business of liquor privatization. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers with Fred Anton and Gene Barr. They're our all-star panel. All right, Fred, I'm going to start with you on this. Liquor privatization, 3 governors. We're now up to the 3rd governor. You've followed this closely over the years, tried to get liquor privatization. Do we do total privatization? Do we do partial? Lawmakers don't seem to be on board. Governor wants to take, completely privatize it. 600 retail outfits to go to 1,200, sell the licenses. Give us your perspective on this.
We at the PMA totally, completely endorse the governor's plan as stated. We believe that the system should be privatized for 3 reasons. One, overwhelmingly the public wants convenience and choice, as the governor has sold this plan or attempted to sell it to the public. 2, this is not a proper function for state government. We're one of only 2 states. For those 2 reasons alone, these stores should be privatized. Now, the governor has done a very clever thing here in promising the proceeds, the $1 billion, to be used for education.
Mm-hmm. All right, Gene, let's go to getting this through the legislature. I mean, you've got some Republican lawmakers who don't want to see the expansion of alcohol into their communities. Right. You get some who say, well, you know what? Maybe we just ought to semi-privatize. Right. Don't go the whole way. Right. Now, again, you've covered this. Where does this all fly? I mean, do you think there's going to be a compromise on this? Is Fred, obviously many in the business community supports the total. Is this likely to see some kind of a hybrid?
I think you're going to see some changes. What's going to happen, I don't know. First off, to go back to what Fred said, I don't think people care. I mean, certain people care ideologically who sells. Most people don't care who employs a person behind the counter. What they know they want is they want beer and wine in grocery stores. They want beer and wine in convenience stores. As Fred said, they want greater customer choice and convenience. I think that there are fewer legislators now who are opposing this, saying, oh, geez, I don't want greater expansion. Yeah. I think they're saying, hey, look, you know what? Government shouldn't be in this. We need to get them out. 48 other states have figured this out. And I think the difference here is previous times it was simply privatizing without expanding the beer and wine sales. That's the big seller here. That's the huge piece of the customer choice that people want. So I think that there will be significant pressure to do something, whatever that something is, get it done this time.
Yeah. Fred, go ahead.
My assessment is that some sort of a hybrid plan is all that's likely to pass. Why do I say that? I say it because the strong advocate for this plan is Mike Turzai. The other three legislative...
Majority leader in the House. Go ahead.
The other three legislative leaders have all said, or at least Scarnati and Sam Smith have said they are for some sort of incremental approach. So that's what I think of.
Gene, you're shaking your head.
Yeah, I think that, let's look for a minute at some of the objections to this, which I find kind of interesting. You have people say, I don't believe it's going to lead to tremendously increased alcohol use. But you have people say, well, we're the largest buyer of wine in the world. Look at the purchasing power, and the stores have done better. I'll agree, the stores have done better. In my view, they've done better because of the threat of privatization. Once that threat goes away, I think the stores go back to what we've all known for decades here in Pennsylvania. The other reality is, if this purchasing power works so well, why not do it for automobiles? Then why not have a state-run automobile? The reality is it doesn't work long-term. People want choice and convenience, and I think we're going to see strong proposals to bring greater choice and convenience for people for the purchase, particularly of beer and wine.
All right, before I let you guys go, I want to go to one other thing. The governor is recommending continuing various business phase-outs and cuts, particularly in the corporate net income tax. Fred Anton, what's your sense about whether we'll continue to see the business tax cuts?
I think we will. I hope we do. I think that it's extremely important for the Pennsylvania economy. I'm extremely disappointed with Pennsylvania as a site for attracting companies and for not losing companies. I hope with the natural gas expansion here, we've got a real chance, if our taxes go down some, to acquire some business.
Someday, Gene, we'll have to get you back here. Somebody has to explain the Delaware loophole and its full implications
There's
to
no
me.
such thing as Delaware loophole.
Okay, all right. But you're going to have to come back and explain this.
We'll talk about that.
I only partially understand it. All right. A great update. As I promised, we're going to get all sorts of views on this, and we're going to follow these two issues in particular. I didn't even get to ask you about the lottery privatization.
We did. Yeah, that's right.
Yeah, we'll get into that.
Or the pensions.
Or the pensions, two big things, which we've covered. All right, again, coming up, we got health care update. We're going to look at Medicaid expansion. It's a huge issue for the state. Governor Corbett seems to be leaning against going forward with Medicaid. He's not quite closed the door. One of our health care experts will be on the program next to help us sort all of that out.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Welcome back to the program. Well, we're going to talk, it's time for our important healthcare update. One of the experts that we bring in from time to time is Dr. Stuart Shapiro. He's the president and CEO, if you will, of the Pennsylvania Healthcare Association. Doctor, thanks for coming on, as always. Look, before we get, we want to talk about budgets and numbers and money. We're always talking about budgets and money. But I want to spend a moment or two talking about Medicaid expansion. The governor gave this speech. It didn't look like he closed the door completely on Medicaid expansion. By the way, we're talking about the option that governors have in legislatures to accept the Medicaid expansion, paid for the first 3 years by the federal government, then after less money, 90%. Governor is not quite sure about that. Give me your perspective on that.
Great. I've been working on national health insurance for 30 years. And I've got to tell you that Governor Corbett's decision was 100% right. Mm-hmm. The reason it was right is that we have an economy that cannot at this point absorb a $4 billion addition to the Medicaid program in Pennsylvania. Mm-hmm. Pennsylvania is second in the country on Medicaid expenditures as a percentage of its budget. It spends greater than a third of its budget already on Medicaid. If he had expanded Medicaid right now, 1 in 4 Pennsylvanians would be on Medicaid. That is unsustainable. Mm-hmm. The governor's a little bit like Wayne Gretzky. He doesn't look like him, but he thinks like him. He doesn't go where the puck is. He goes where the puck will be. And in this case, if the governor expanded Medicaid, it would add $4 billion to the budget. It couldn't be sustainable. And the Commonwealth's budget would have to cut back on services to the elderly, mm-hmm. to the disabled, to schools, to kids. If he had expanded Medicaid now, it would have caused massive cutbacks. So first, the governor was right. Second, the way he's approached this is he said, let's approach it and find a Pennsylvania way to do it with some flexibility. Mm-hmm. And he's asked the Secretary of HHS, he's thrown the ball to her, and he has said, federal government, work with me to do it in a way that we phase this in over time. Now it's up to the federal government. Yeah. The governor is right, and he's to be congratulated on this decision.
Yeah, we've had some folks on who obviously have different views about this, which is why we have the program, because we want a variety of viewpoints. As you know, you've been on often over the years. What about the uncompensated care? What about the fact that physicians treat people who come in, they don't get compensated, hospitals? Is there another way? Would you suggest another way to handle that problem?
Well, sure. There's all sorts. What people aren't talking about is the way that the tax credits can be used mm-hmm. to buy insurance for people who are between the poverty level and 133% of the poverty level. There's still ways to use other mechanisms to get care. And what this is all about is that the hospitals, the pharmaceutical companies, and especially the pharmaceutical companies who are advocating for this expansion want all those extra dollars for drugs. There are ways to do this. Mm-hmm. The governor has asked for flexibility because he doesn't want to cut services to the elderly. And if he expanded Medicaid, services to the elderly would be cut.
Mm-hmm. All right, let's turn our attention to, in general, the governor's health care budget. And there are a bunch of pieces to it. But in your sense, what do you think the most important aspects of the budget recommendations that dealt with health care? What did he say that you liked or you didn't like?
Again, I want to come back to the governor as a priority setter. And I'm not here as an advocate for the governor. I'm here to talk about services to the elderly. And my job, and I get paid to represent the elderly. The governor said in his budget, the elderly and the sick elderly and the frail elderly and the disabled are a priority. And he made that very clear with his spending plan. He didn't go hog wild, mm-hmm. but he has begun to restore the dollars that were cut under the Rendell program for the elderly. And I think he deserves to be really congratulated for that. I want to say that again. The governor made services for the elderly a priority in this budget.
Okay, before we get to, I want to talk a little bit about obviously something that you work with closely, the nursing homes, residents, that deal with the elderly in a minute. But right now we're talking about money. We'll take some time and pay some of our bills.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program with Dr. Stuart Shapiro. He heads the PA Healthcare Association. We're chatting. We're getting our healthcare update. You want to make a quick comment about the budget and where all that goes?
Sure.
Go ahead.
As I said, the governor set the elderly as a priority in this budget. He didn't expand Obamacare, which was, I think, a wise decision. But there's still a long way to go for the services for the elderly. Mm-hmm. When Medicaid still dramatically underfunds what it the real cost of care in nursing homes. And unfortunately, because Obamacare so took dollars away from Medicare, right, and the federal government keeps looking for targets to save money, and they keep taking it away from the elderly, nursing homes in Pennsylvania still remain very, very fragile. Yeah. And although the governor increased it a little bit this year, it's the first increase in 5 years.
One of the subjects that we've done, for a decade on this program is tort reform. We've made some, adjustments. It's every physician I talk to constantly brings up this business of defensive medicine. I'm practicing it. Do tests that maybe, I might otherwise not do. What's your sense about that? Where's this all heading?
Right now, trial lawyers come to Pennsylvania and are attracted here like flies to flypaper. Pennsylvania is ranked second worst in the country. An example is there's an out-of-state law firm that has advertising full-page ads attacking and trolling for clients in nursing homes across the country, across the Commonwealth. 18 full-page ads in the last 2 or 3 weeks. 18, from Scranton to Washington. Right now, pending before the Senate is a bill, an apology legislation bill. Apology laws are common sense reform. It says that if things go wrong, a doctor or a nurse can sit down with a family and say, I feel really bad.
Yeah.
This shouldn't have happened. It happened. This is why it happened. And if compensation is due, then it's paid.
But let me just make the point. And not have what the doctor says be used in court, right? Isn't that the whole point?
That's what the law does. It's as simple as that. Now, the fact that if they made a mistake, they can still be sued.
Sure.
But just that dialogue, that discussion can't be used against them. Now, that's common sense reform. 38 states have passed it. All the states around us have passed it. But in Pennsylvania, when something goes wrong, the doctors or the hospital people or the nurses, they literally can't have that dialogue.
I'm supposed to be neutral, and most of the time I am. On that, I agree with you. I'm going to say this. I mean, that makes no sense not to allow a
University of Michigan, which has this law, has reduced medical malpractice claims by over 50% since this went into effect. This is common sense reform. It ought to pass the Senate. Last year it passed the House.
We have about 50 seconds left. Tell me where you think, that's right. Tell me where you think it's going to go.
It's in the Senate.
Okay.
We hope it's going to pass. It passed the House last year overwhelmingly. 85% of the Democrats and Republicans voted for it. Wow. This is bipartisan in the Pennsylvania Senate. It's sitting there, and all we can do is ask that the Pennsylvania senators move first-rate common sense reform.
Thanks for the update, as always. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.